Good morning, everyone. I'm Dr. Riya Majumdar, and I'll be presenting a study on intraocular foreign body injury in children and the factors associated with endophthalmitis. Intraocular foreign bodies are present in almost 40% of all penetrating globe injuries. Visual prognosis usually depends on the zone of injury, type and size of foreign body, and the subsequent complications associated with it. Here we can see localizations of different sorts of intraocular foreign bodies. This is a corneal IOFB, this is a lenticular IOFB, and this is a intraocular foreign body lying on the retina. And here is a USG-B scan showing associated retinal detachment. The clinical history and examination in these patients is very important. Localization of IOFB is usually done using appropriate imaging techniques. Sweet localization technique can be done in these patients to gauge the zone of injury and the location of the IOFB. Management usually is consisting of appropriate antibiotic coverage and appropriate surgical management. Associated complications like retinal or choroidal detachment and endophthalmitis can be managed accordingly. The risk factors for endophthalmitis in these patients are organic IOFB, delayed removal of IOFB, posterior open globe injury, traumatic lens injury, and contaminated settings of surgery. This is a institution-based retrospective case control study showing in which we studied 100 patients aged less than 20 years diagnosed with globe injuries with IOFBs. We wanted to study the clinical profile of the IOFB injury in children and the factors associated with endophthalmitis. This is the demographic profile of the patients. Males were more commonly affected than females. The age distribution showed maximum IOFBs being present in the age groups of 5 to 10 years of age and 10 to 15 years of age. The type of IOFB found was most commonly metallic IOFBs, and the most common cause of injury was firework injury. In males, metallic IOFBs were more common, while in females, vegetative IOFBs were more common. 12% of these patients were diagnosed with post-traumatic endophthalmitis associated with IOFB, more commonly associated with vegetative sort of IOFB, and with delayed initiation of treatment, that is more than 1 month. Zone 2 injuries were more commonly associated with endophthalmitis. Associated ocular features like uveal prolapse, traumatic lens injury, and retinal detachment were more commonly associated with endophthalmitis. The take-home points from my presentation were: the clinical profile of IOFB injury in children is a little different from that of adults, metallic IOFBs being the most common foreign body. More common in males is metallic foreign bodies, that is due to firework injuries, while vegetative is more common in females. Vegetative IOFBs are more commonly associated with post-traumatic endophthalmitis. Zone 2 wounds are more commonly associated, while associated uveal prolapse, traumatic lens injury, and association with retinal detachment are all risk factors for endophthalmitis. Conclusion: open globe injuries in children may be associated with presence of IOFB, which is most commonly metallic in nature. Appropriate clinical evaluation and early management are necessary to prevent post-traumatic endophthalmitis. Thank you.
Very well presented.